Good morning, Mr. Chairman and members. My name is Dr. Keith Rohde. I'm a member of the California Veterinary Medical Association's Board of Governors and its president-elect. I'm a 2006 graduate of the UC Davis School of Veterinary Medicine, and I am a co-owner of Woodland Veterinary Hospital, where I've been practicing for 16 years. Thank you for the opportunity to testify today in opposition of AB 2606. Based on my longstanding involvement in CVMA leadership, I can attest that the issue of cat declaw has indeed been front and center in our association for many years. In fact, the CVMA now has one of the strongest declaw statements of any veterinary medical association in the country. Pursuant to that policy, the CVMA strongly discourages owners from declawing their cats, and the CVMA recently hosted 2 well-attended seminars on alternatives to declawing cats. But our opposition to this bill is not about declawing specifically. I am not pro-declaw. I have 2 indoor cats who are not declawed, and in 2018, the doctors of my hospital unanimously voted to stop doing the procedure at our hospital. That being said, our concern is that this bill, if signed, would create a precedent in statute that directly impacts our lawful scope of practice as veterinary professionals, and it would do so in a situation where the profession has already self-regulated much of that declawing to where it's now rarely performed. It is concerning to think that at any time an outside group may have an aversion to a significant surgical procedure or treatment, that group would be able to memorialize a ban of that medical procedure into law. And truly, that goes for any health profession, not just veterinary medicine. You may ask, if a good majority of the veterinary profession is trending away from the surgery, then why not just ban it? Then what do we do in the very rare instances where we have a client with an autistic child in the house and the cat is scratching that child? Or a senior citizen who lives alone and has a cat that provides them with companionship, but they're taking Coumadin or chemotherapy and can't risk being scratched? Should these individuals have to relinquish their cats? The CVMA's short and simple answer is no. In both of the examples I just gave, the cat owners should be counseled about the surgery, the health circumstances at issue should be closely considered, and the surgery should be performed as a last resort based on the professional judgment of the veterinarian. Thank you for your consideration, and I'd be happy to entertain any questions.
Thank you very much.